Hi guys, welcome to BurgerBash episode 4. Today is a special episode dedicated to the coronavirus. It is something that's trending right now and it's something that people need a lot of answers about. I've brought alongside with me Turks from episode 1. He's going to be hosting the show, and he's also brought alongside with us a special guest, Dr Shabaz, who's going to be talking to us about some very difficult questions around the coronavirus and how it's affecting us as a whole, as a populace. And I'm just going to hand over to Turks. But before I do, I just need to mention, for this episode, we're not having any food because we are in a medical establishment. So thumbs down. But I do owe these guys a burger, so it will happen. And please carry on supporting your food establishments. It's really important. They are still available for collecting and delivering, so Absolutely. Please carry on supporting them. But Turks?
Yeah, good afternoon, Salam. Good afternoon to everybody. Hope everybody's in good health and doing the best they can in these difficult times. We are live here at Burnley General Hospital. Two amazing guests today, Dr Shabaz Afzal, who's very kindly taken time out to join us, and of course another close friend of mine, BurgerBash. We're going to drill down shortly, get some real answers about what's been going on regarding the coronavirus. If I pronounce that right, sorry, is it the coronavirus? Going to drill down, get you some real answers, and then maybe drill a little bit further into Dr Shabaz's life as a doctor in the NHS and see what that means and get a few answers and things. So I'd just like to welcome you both onto the show, onto the BurgerBash show, and things like that. We'll just get straight down to it, I guess, with a few questions. Thank you.
So just to begin with, if you just start to introduce yourself in full and just give a quick background on what you currently do. So you're a general practitioner?
Yes, so my name is Dr Shabaz Afzal and I'm local in terms of the Lancashire area, one of the GPs that works. Usually it's a locum, which means covering quite a few practices, but my aim going on from April, depending on how things go, is to actually settle in one particular practice in Burnley, and from there still branch out to help some of the other surgeries that I've been doing. So in the past, just the aim is to just help the local community at least with the medical needs.
Right. So the first question I've got for you, Doctor, is quite it's quite a serious topic. Is how serious is this? Because it feels to me and Turks that some people just aren't taking this very seriously at all.
Absolutely. I mean, let's just go straight in here, Doctor. First things first. This coronavirus, myth or reality? Heavy flu, as some people are saying, or is this something completely different? Give us a lowdown.
It's serious. It is that serious because if you look at what's going on at the moment with not just the UK, other countries, it's almost coming to a world lockdown. So you wouldn't make a decision, or some of the decisions that are being made, lightly because of the economic impact in so many ways to us, psychologically, mentally, physically, medically as well. So it is serious. When you say, is it just flu? It has similarities in the sense that it is a virus. So viruses are like the common cold. There's lots of viruses around. Okay. The difficulty with a virus compared to some of these other bugs, like when you get a chest infection, when you get a bacterial infection, is that antibiotics don't work. So it is very serious, and it is a lot more contagious and damaging than the flu and some of these other simple colds, which most people get over. So it needs to be taken seriously, and I think that's one of the problems, that it hasn't been taken seriously, hence why what we call a pandemic, which is where it spread all over the world, is getting to a stage where we're now thinking, what are we going to do?
Right, okay. So it's quite serious.
Yeah, so in terms of the NHS, they are officially treating it as a pandemic. There's no casual approach to it.
No, a pandemic approach, we have something called WHO, which is the World Health Organization, and they work with, in each area you've got something called public health, which is your departments that look after our health from disease point of view. To call something a pandemic, pan means all around, compared to endemic, which is just in a small area or like one country, is a big statement. So when that came out last week, that showed the scale that this has got to, and how we need what you call a global approach, which is the whole world needs to come together to manage this, because it's not an individual country. approach.
And is it fair to sort of say perhaps that it's maybe caught doctors such as yourself and the NHS a little bit off guard? Is that reasonable to sort of say with the scale of what's...
Oh, it's massive. It's massive. It's not caught off guard. The caught off guard is everybody. It doesn't matter who you were, the government, nobody expected it to firstly spread the way that it did, but that is due to modern technology of travel. We are free to move around in almost every country in the world. So the spread of something that started, as they say, in one area has spread over the world, and some countries affected more. We don't know why. Is that just because they're popular destinations? What's the background? How long it's been around before it started to show its symptoms? We don't know. But look how the common cold common, spreads all over the world. Everybody can get it. So this is following a similar pattern.
Right. So is it, sorry, Bash, so am I right in understanding, and I'm sure lots of the public would want to know, this coronavirus, is it a completely new virus, or is this something that maybe happened 6 years ago as well, but on a small scale? It just seems to have come out of, and I'm sure I speak for everybody, it just seems to have come out of nowhere all of a sudden. Are we talking about something that's completely new? Or is it a variation of the common cold on a more serious level? Or is it just...
Okay, let me explain.
Yeah.
So it is not a new virus in the sense that it is still in the similar family of... I don't know if you in the past heard of MERS and SARS, which was which was a Middle Eastern one which affected, and then SARS, which was the other one that caused everybody breathing problems. So this is in a similar family, but the difference with this one, and because there's been lots of what you call conspiracy theories, that is this man-made. To go, I've read up some articles. You have to be careful what you read and where you read. There's been a lot of research done in something where what you call it reverse engineering. Because we've got the virus, you can then go back and look at its genetic makeup, which is how everything is made up. And when they've actually done that, they've realised that it's as if it's something called a mutation. Mutation means when something changes, evolves. So the virus has been around for a long time, and it's been a known virus, but the current what we call strain, which is the form, which is this COVID-19 as it's been known as, is actually just so much stronger, so much more adaptable, how it sticks to the body and how it transmits, that hence why it's what we call more contagious, which means how easily it's spread. So that's the difference. So it's not totally new novel, but we haven't got anything prepared ready for it, such as drugs, because already viruses, look at HIV, one of the most deadly viruses, how difficult it is to treat. We're only just trying to manage to contain that with antivirals. So the new research at the moment is, are any of these antivirals going to help to try and combat this?
Okay, thank you. So when people are saying that it's just scaremongering, I think based on what you're saying, there's no argument for it. It's not scaremongering. You can't.
I admit at one point, even I, as a medical professional, maybe didn't take it as seriously, because it's that approach which we all have. We've got media, you watch TV, oh, it's not on my doorstep. That can mean your house, that can mean your country. You can think that approach, and then you suddenly realise this is a bit more serious. And so yes, as you said earlier about the caught off guard, I think the extent and the severity has caught everybody off guard. But now I think a little bit late, but we should take anybody that isn't. You need to take this seriously. This is life-threatening to maybe not yourself, but overall to your loved ones, to the elderly. So it's going to have a massive impact.
Because you've been seeing some people, it's a limited amount of cases, but I think some research from China and Italy where they were quite hard hit, saying that some people are getting it a second time. Do you reckon that's the second time, or do you reckon they just haven't fully recovered?
The second time, there is no evidence at this moment in time of catching it a second time. And that's important, which if we go on to talk about isolation, I'll explain why the second time theory is important, because otherwise, with a family of 8, you could be in isolation for the next 10 months if we talk about repeated. So we'll go into that. But at this moment in time, there's nothing to say. What is important, which I'll explain to you, is currently what's going into research is what you call an antibody test. There's two lots of tests. There's a test that's getting done, which, please, the government, if we can do more of this testing, we'll know who has and who hasn't got it.
Just on that subject, Doctor, is there a lack of tests available? And if so, where has that come from? I mean, just as a general member of the public, both me and Bash would have assumed that there would be a test available for everybody who suspects that they have this particular virus. Is this something in developing a test that we're behind on, or is there no test available?
The test is available. There was even locally, Blackburn had almost like a drive-through service where suspected cases could be sent. I think because of how overwhelmed the service is, there is not enough tests. The government recently, Boris announced, I think it was last week, to say 10,000 more tests are coming in. When, where, nobody knows. We as doctors are, especially GPs, as one of the frontline members of the medical profession, are very worried. We need testing. If we are coming into contact with patients on a daily basis that are suspected cases, some have actually gone on to be confirmed cases because they were that unwell, they were transferred to hospital, they had the test. Because if you are sent to hospital because you are unwell with breathing problems, then you are the highly likely person to get tested. But how does that impact the people that you've come into contact with, such as the doctor? So we are trying to say we need testing for the frontline staff. Who's listening, when they're going to listen, nobody knows.
Okay. Just following on from that then, Doctor, can you give us, and certainly for our viewers out there and perhaps for me as well, with a vulnerable child at home, can you give me, I've obviously seen the news, can you give me some examples of real practical warning signs that this virus could be, about to take hold, or it's an early indicator? What is the difference between me having a hay fever sneeze, for example, which I do suffer from, and drawing the line between that and then thinking, well, actually, this could be something else? So, just a little bit of guideline perhaps for our viewers out there.
Okay, so it's a very difficult one for patients and for us as well. And that's why this has become so overwhelming, because it's very difficult to differentiate, which means tell the difference between what's a common cold, what's normal, and what isn't. Yes, things have gone scary because now you could have a cough where you wouldn't do nothing about it, but now you think, have I got coronavirus?
Absolutely, yeah.
So the most common symptom to look out for is what we call a persistent cough. So that's more than what you call just your average cough. You think, right, I've suddenly got a new cough, it's not going away. Okay, so persistent cough is one of the main symptoms.
So, is it dry?
It's normally dry. It's normally dry.
Persistent cough.
Yes.
Right.
But again, there's no hard and fast rule. Sometimes you can have a cold alongside it. So you might have a chesty cough if you've got a runny nose. So you can't. So runny nose itself is not one of the main symptoms, but the persistent cough is. The second one is temperature. A temperature, what we say is if your temperature above 37.5 or officially above 38, if you've got a temperature that's high, and again, it's also unexplained. You can have tonsillitis. A lot of people get tonsillitis, so you get a high temperature. So if you've got an obvious reason for a temperature, then that's different. Water infections can cause you to have a high temperature. So we're looking at temperature and a persistent cough as any of them two symptoms that are the common symptoms that you would think, right, I am a suspected case, okay? But what used to be was every single person with them was overwhelming the health services because it was, right, I'm at risk, I need to get tested, I need to get it confirmed. That's not the case. So if you want, I can explain it now, or if you want to explain later how the impact and what you're meant to do if you get these symptoms. Just going back to your, like you said, your child. So asthma, it's very difficult to say, has my child just got asthma? What's ongoing? Is it just an asthma attack? or is this the new coronavirus? So the things that you've got to look at is, first of all, was he at risk? It used to be if there was somebody that had travelled. So at the start, when all this came out, have you been in contact with someone that's travelled from China or one of the affected countries? Yeah. That soon went out the window because we realised, because it was so difficult to track people in the UK, one of the cases that at the start hadn't even travelled.
Right.
So that's when we realised it's not going to be so simple. So just because you haven't been in contact with someone that's come from Singapore, China, doesn't mean that it can't be around here. And as we realised, Lancashire, just as much as other areas, are starting to get cases come through. So it's difficult, but that's why we've got a service of advice, where instead of going in to see a doctor, it's all what we call a telephone triage system. You can ring your surgery like you would to book an appointment, and you can have a telephone triage to speak with a health professional who will go through your symptoms and help decide what's the likelihood of what this could be and how to manage it and give you that advice.
Right. So is that local GP first, or is that through 111?
111, I don't know if anybody knows anybody that has tried to get through to 111 at the moment. On the telephone, you could be on hold for 2 to 3 hours. They are overwhelmed. They are working well above capacity. So is every single member of the health service. For GPs, we say adamantly, do not come into practice, especially if you are a suspected case. Your visit to the surgery, you might infect somebody in the waiting area, somebody at reception. You know, the whole idea for limiting transmission is stay at home. Everybody has telephones or the internet, and that's what we are encouraging to use. You give us a call, you will get a call back, and we can discuss what is happening and decide the next steps.
Okay, excellent. Yeah, thank you very much for that, Doctor. Obviously, then just moving on from that, and there has been a key word, a buzzword almost, now it's everywhere: self-isolation, isolation. In my mind, and I'm sure a lot of the general public would probably agree, is I'm just struggling to understand, and perhaps you can help me sort of shed light on this. If I was to go into self-isolation with symptoms of this coronavirus, and I have people at home, would I not be at risk of putting them people I live with, in other words, my wife, children and things, at risk? So would it not be more sensible to sort of say, well, you've got symptoms of it, you need to go to such a place, a secure pod or a hospital or something? So by self-isolating at home, being in my bedroom, for example, how long can one live in a bedroom? You know, can you give me some background on what you understand as a medical professional by self-isolation? Where's that come from, and what do you actually want from somebody that, say, has that, you know, in practical terms?
There's quite a few parts to that, so it's difficult. Let me try and cover some of it. So the word is changed from self-isolation to isolation, and I'll explain why. Because it depends on whether you live alone or whether you live with other people, for a start. So your example will go through, but the easiest example is self-isolation first. So if you live alone, then self-isolation, and you suspect that you've got symptoms, you don't even need to ring 111 to tell them you think you've got them. It all depends if you're well or not. If you think, right, I've got a slight temperature, I've got a slight cough, like you would with a cold, you get on with it. The difference is, to get on with it here is to isolate yourself, stay in your own house, stay in your own environment, and let the symptoms ride out, because 80% of us will not it's like having a cold, a little bit of a fever. You will get over it in 4 to 5 days. The virus will be out of your system by 7 days. That's where the number 7 has been extrapolated from, or chosen from some of what we call the chief medical officers.
Just to clarify, not everybody who gets the virus is going to become ill.
No, you might. As some of the young people, even children are actually very strong against this, because children have a good immune system. They're exposed to a lot of bugs.
Is that where that's come from? That children, I read in the news that children are one of the least risk groups? Because I always assumed that children would be one of the highest.
For this, no.
For this, no.
For this, what the research has shown so far, nothing is 100%. So it's all from what they are learning and from what they have seen. A lot of the information is actually coming from the cases in China and obviously now with Italy. So they're learning a lot as the days goes on, and that was one of the reasons why the schools were kept open a little bit longer, which was a controversial area. And it caused a lot of outcry, it caused a lot of concern. And the logic made sense. I agree the logic made sense. So one of the reasons was, if you have got, let's say, 2 children at home, as you said, it is hard to stay in your bedroom. How do you keep a child isolated or in the house for 7 days, 14 days or ongoing? Okay? If you have to work and nobody is unwell, you still have to keep them somewhere. Who are our commonest people that we use for babysitting, looking after children? Grandparents, other family members. So what we're doing is, and also who are the most vulnerable, which I mean, by vulnerable, I mean who are the most at risk people from the virus? The elderly, those with long-term health conditions, diabetes, asthma, epilepsy, anyone with these sort of conditions. So what we are inevitably doing, or what the risk was, that these children that might be carriers but well themselves are spending all day with our elderly loved ones and inevitably causing the rise. And that rise will also have a big impact on our health services, because these are the patients that need the health service more anyway for their what we call chronic conditions that they've had a long time. And imagine now they're all getting an influx coming in. So that was the initial reason that it was safer to have the children in school. Now, because of the spread, we've realised, well, the government's realised that it's just not safe overall, and we need everybody to be in their home environment, and hence why schools closed, and obviously as of yesterday all social areas have closed, again to try and minimise. And there is method in what sounds like madness, which is all about, you can't prevent this from spreading, but you can minimise the spread by keeping everyone in what we call isolation. So the further away you are from each other, the less exposure you have to each other. That is one of the reasons, hence why all these rules are coming into place. So that's with one part of the isolation. You mentioned about a family isolation. So yes, in your family, what you've got to think is, okay, who is in my family and who is at risk? As a family, the rules currently are, as it stands, are, as a family, if one is suspected, the whole family isolates for 14 days. Okay? It's going to get complicated, and what we could do is, we could see if we can actually put a link to a really good picture that explains isolation from self and as a family, and how long you isolate and who isolates for how long. The reason for the family is because it can take 7 days for, if I've got it, for me to pass the symptoms on to you, pass the virus on to you, what we call that incubation period, how long it stays, how long you're contagious for. So if you then isolate the rest of the family, you are not passing it on to other people. If you go out and I've passed it on to you, you are then passing it on to everybody else, not knowing, because in your eyes, you are well. It's only somebody at home that's unwell. Practically, the guidelines say, as the first person to get it, after 7 days, you are now okay. The others need to still self-isolate till they've reached the 14 days. What can happen is one of your family members might get the virus after 7 days. So they need to isolate for another 14 days from then. And if somebody else gets it later, it's 7 days added on from the first one. Like I said, it's very complicated.
It's like a cycle.
It's a cycle, but
isolation and
But it won't be the case of you are isolated for months, because the risk for you going back into the community once you've done your isolation is very low.
Okay.
So, but I think we'll put a link to that on your page, because I looked at it as well, and it's a really good explanation about isolation, but also why it's so important.
So thank you very much for that. That really helps clarify certain things for me, and I hope so for our audience as well, which I think is what's needed. Just following off that, you mentioned something there about and you just sort of said it at the end, the word months. Realistically, as a practicing GP, are we talking weeks, months? Are we talking a year of this, and before things finally sort of settle? I mean, I know it's an open-ended question, but do you have an input into that, or a little bit of your own thoughts on that? I mean, can you?
Yeah, it's you're right. Nobody actually knows the answer. All we can use is prediction models, algorithms to work out the way things are going. We are nowhere near the stage of knowing the severity and how far this is going to be widespread yet. Hence why these measures to try and what we call contain the level of exposure, the level of impact that it's having. So it's very difficult, but I can tell you now, and I think we all know that, we are in this for the long haul. We will get through this, just like other pandemics, but yes, expect to be in this for the long run, and the only way we can speed things up and get through this better is if people are not selfish and everybody follows the advice, because it's not just for you, the advice is the impact that it has on everyone else as well.
And I don't know, obviously you'll both be aware, there's been a lot of talk about Handgel, the selling out of it, the use of it, buying of it, trading of it. And then there's been some disinformation as well on social media. As a doctor, can you clarify for us, this use of Handgel and stuff, is it for real? Is it something that you're advising? There's been rumours that it's a virus, so it won't be affected, it's not doing any good, it's better to wash your hands. What is the official sort of line from the NHS?
I was going to say, before you do that, because one of the questions I wanted to ask was around hand wash versus soap.
Yeah, so you just clarify the rules on, I mean, is it true? Should we be getting hand gels consistently?
Okay, let me explain then. So it seems like such a basic concept to wash your hands, okay? And it's had to take something as serious as this for us to realise the importance of washing our hands. It doesn't really matter which method you use. So what people, the whole panic about sanitizers, hand gel, if you have access to soap and water, you can't beat it. Right. Not only does it clean your hands, actually you get rid of anything that's on your hands. So hand sanitizer is also what we call more of a convenience. It's there, it's accessible, it works, hence why you go anywhere, hospitals, any environment, what's the first thing you have to do when you come in? Clean your hands. They don't have a sink, they have the machines, and again, not non-contact. What's going on at the moment is, again, it's panic buying, it's also ethics, because there is a need and this sudden rush to keep clean, and also a panic. Yes, the media is to blame for good things, but also for creating mass hysteria, which could have been done in a controlled way, and hence why what we call simple items, hand gel that used to be left and nobody uses, is now a commodity and is being sold for these escalating prices. Should it happen? Definitely not. Is it going to continue? I think things are only going to get worse from that point of view. But doesn't mean there is still access. You can go into supermarkets. We went into shops the other day. You can still get hold of the basic soap, hand wash, which is going to do the job. And if you are isolating as a family especially, hand sanitizers know better than going to the sink and washing your hands at every opportunity. You know, the basics.
So the message for everybody out there is to keep on washing your hands, not necessarily getting caught up in the panic buying of hand sanitizers. Is that from a medical professional? Is that fair? Yeah?
Definitely. There's lots of what we don't think about is, when do we wash our hands? Okay. I recently have just done a talk in some of the where some little children go for Arabic classes locally. I got invited to do that, and it was all about hand washing. and how to, what I showed them was the techniques that's even what we call the WHO, what I mentioned, the World Health Organization, their method. I think a lot of people now, it's in the media, have been talked about the happy birthday song, or whatever song you choose, so that as long as you're taking about 20 seconds to wash your hands, so the proper technique, and the kids actually enjoyed it. Some were good at it, some had never heard of it, but one of the questions I asked them was, give me some times when you should wash your hands, and it was very interesting, some of the answers, but the basics are, as we should already, before you're going to eat, after you've eaten, after you've touched anything, after you've shaken someone's hands, we have to think...
Using the bathroom.
Using the bathroom, definitely.
Okay.
So one of these things, using the bathroom, you'd assume we do it, but I have gone into so many public toilets and noted people do not wash their hands, and it was shocking.
I'd just like to say there that is a pet hate of mine. You know, obviously, just
it's
on
what I would call a basic hygiene task, but it's amazing how it wasn't done and how we've had to change. How, like I said, something like this pandemic and scares has taken to think about hand washing. So don't take things for granted, but it's literally, that's one of the main things you can do to prevent transmission in your own household and again to other people.
Fantastic. Thank you very much, Doctor. Thank you. I know over to Bash. I know you've got a couple of questions.
Yeah, so
absolutely. Yeah.
At the moment, there'll be a lot of mainly, I say, Asian households, because culturally we do tend to live with our elders.
Absolutely.
And the default position at the moment seems to be that elderly are vulnerable. But there are other categories of people that are vulnerable as well. And are you able to maybe expand on that just a little bit? So we've got, I think as a general, we've got, is it type 2 diabetics, type 1 diabetics, asthmatics, people with like chronic lung issues. But is there any, like, what is it specifically that makes them vulnerable to it, as far as you know?
Okay, it's basically most people that have got what we call a chronic condition, which are these conditions that you live lifelong with, such as the ones that you mentioned, the diabetes, the asthma. Some of them, it's not specifically the condition, it's the fact that when you are on medication, your body's immune system might not be as strong as someone that is perfectly healthy. Okay, so there are certain conditions like those with lung conditions, or if you've had a cancer, meanings that your body's immune system is a lot lower. And some of you might be arthritis patients, they're on a medication which suppresses the immune system because it's the attack on the immune system, which is your body's defense, which we all need. But like I said, in some cases, as Tariq, you know about immunosuppressant drugs. So these are drugs that you need to try and lower your immune system so your body doesn't attack its own. But the disadvantage is that it allows other organisms which are harmful to get into you, such as the COVID. So it's and the simplest way that we've categorized it is anybody that is eligible for the flu jab. So if you've been invited for the flu jab as an adult or a child by your surgery, then that's a prime example of someone that would be classed at higher risk. So you have to be more cautious. So that's probably a more simpler way than thinking, have I got a condition that makes me more prone? And if you are someone that is on one of these medicines that's called an immunosuppressant, then again, you are at higher risk.
Thank you.
Okay,
excellent.
And so on the back of that question, I guess it's a case of kind of a direct plea to the elders in our community, because they do find it quite hard to stay home. It's the same for anybody, really. Like even for someone like my mum, she still kind of wants to go out and about, do like a bit of shopping.
They do.
How realistic is that?
Have you found any examples of the Asian community being a little bit slow on the uptake for the advice? Is it fair to say that we can be...
I don't want to name and shame, but I had to tell my own mum off for being this.
That's quite honest of you.
There was, but it's because I think...
But are we a little bit behind? Maybe?
We are very much behind. In many ways, at the moment there's a big campaign going on in mosques. We all know about the sad news about what's going on in the mosques, and same in Saudi Arabia, about prayers and congregations. Again, a massive move, and the impact that has both religious-wise and just emotionally what effect it has.
So for any cynics out there, Doctor, is that the right move? Was it the right move to do? To
it has to
close
be.
the mosques for all congregational prayers and things?
It has to be.
I know there is talk out there that perhaps it's not the right thing to do.
There's a lot of talk, there's a lot of defiance.
From the NHS, is that?
Yeah, it's
the right
just today we are actually there's a large meeting going on to try and talk to some of the imams of the different mosques, some of the big people, to actually get this message across because of defiance, which means that they're going against the rules. The rules are not there to put us down. The rules are there for the safety of everyone.
Absolutely.
The reason for congregations is, again, it was a case of 10 or more people, you are at higher risk. If you look at who attends the mosques more for prayers, it's actually the elderly. It's actually the ones. How many times have you been to the mosque and the person next to you or someone near you, you can hear a cough, you can have that silence, and all you can hear is cough, 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 sneeze, sneeze, sneeze. Okay. Now imagine these are the people that are not even covering their cough, because you're in praise. If you've got your hands over there. Yeah. So what are you doing? The person next to you, the people around you, don't even have any defense, because them droplets are spreading. And what is one of the main forms of spread of the COVID and indeed a lot of these viruses? Air droplets. So you sneeze, you cough, you are spreading that.
So just to clarify, that is one of the main ways that this particular virus is getting out there. Is it? It's the coughing and the close physical contact, the sneezing. Right.
But don't think that's the only way. That's why we're talking about surfaces and shaking hands, and when you touch something to sanitize after that, because you can pass it on from surfaces.
Right. So this virus can survive on the surface?
Oh, it's short term. People were saying 2 to 3 days. Again, I haven't read the official guidelines, and again, it's one of them things that it's so difficult to test. Right. So they still say, even in your own house, sounds like you're going OCD, but even every couple of days, clean the most commonly used areas. So let's say door handles, if bathrooms are used all day, every day by the whole household.
Can I just clarify here that that's to all the women out there? Clean that. I'm just joking about that. Thank you. Sorry, Doctor. Yeah, you were saying.
He's going to get himself into a lot of
trouble. Get himself leaked. Sorry, Doctor. You were saying. Well, it is a very good point that you made about the masjid and the close contact. And it is another viewpoint that you've given us there, actually.
And let's hope we can get this unanimous decision so that we can all contain this and get back to how we want it, which is being able to congregate, being able to hug and meet each other and share things. But it's all done in the protection, particularly of our elderly and vulnerable people.
Fantastic. I think the key emphasis is it has to be the protection. I mean, we've got that potentially could have been coming up, but let's keep it realistic.
That is a concern for many people in the Muslim community. The upcoming sort of congregational evening prayers. Just based on what you've said so far in this fascinating interview, I've got to say it's looking likely that there may be no congregational prayers, possibly.
It's a risk at the moment.
It's a big risk.
It is, with the way that things are going, I can't see things changing in Ramadan is coming up in
April,
3 weeks?
Possibly April the 23rd.
Middle of April or something. So I can't see things changing. If the advice, even for like the food place, all the venues, has been for the next, probably the foreseeable future, which could be the next month. So I can't see things changing. The one thing, I can't call it a positive, but the way that we can see Ramadan coming up, it has many benefits in terms of what we, particularly as Muslims, can do, and that can still be a widespread example. So prayers. So we talk about prayers. So what do we do before prayers? Wash yourself. You're not just washing your hands. We have a ritual on how to wash, to clean. Even this whole toilet paper saga can just go out the window, and you don't have to pay £10 a roll and all these memes that are going around. Why? Because there is alternatives that we have been using from Kingdom Come in that sense.
Yes,
so why don't we now think, okay, how useful that is and what impact does that have? So the cleanliness side, washing our hands and keeping clean, we do that before prayer. So why don't we make sure we are continuing to do that? That's the first step. Ramadan, what are you eating all day?
No. Ramadan
okay. For those that don't know, or the non-Muslim viewers, so from sunrise to sunset, it's nil by mouth. That's food, water, smoking, anything. Okay. So why do we need to hoard food if we are not eating all day? So that will also ease some of the pressures on the supermarkets, which it's unbelievable. Again, it saddens that how selfish people are, how things have become, that who are losing out? Our most vulnerable, our elderly, those that can't get out, that rely on food coming in on the basic foods that is long lasting, not even the bread, which has a short shelf life, the commodities that last longer, and these people are losing out. So it's crazy how things have gone. But Ramadan will actually be a useful time. Think about what we do towards the end of Ramadan. In the last 10 days, we have, I don't know the English term for what we call itikaf. Seclusion. Okay.
It's self-seclusion almost. Yeah.
So that, in a way, is kind of this isolation, but you are using that time to actually just think about yourself, detox yourself, purify yourself, pray, just forget worldly things. So,
and again, that's another viewpoint there for our viewers. A lovely sort of upbeat, especially in these times, sort of message there that perhaps there's no positives from this virus at all. However, make of it what you will is the message. Is that right, Doctor?
Try and get
so have a look at yourself, and if you are in self-isolation, take some time out to reflect.
And use that time to help others, because that's one of the things, charity, as part of our religion. So charity comes in many ways. You've got the essential that you have to do, but what else can you do for your community? And there is some good people out there, even locally. There's a couple of the groups that I know.
Fantastic.
Can I mention?
Yeah, absolutely.
Yeah.
Fantastic.
Some of the ones that I'm going to get involved with, like Rise Support that Amal Ansar is doing, Hope for Mankind that Rizwan Ali is doing. They're just two of the ones locally that are working tirelessly. They've done a lot of projects abroad, but they're now trying to, with the homeless. Now they Rizwan had a meeting recently about what they can do about our elderly and who's going to get their shopping, food, things like that.
Have you personally been impressed with the way the community has galvanised and come together at this time? And there is a lot on Facebook. There's a lot of groups, Bash, as you know. Have you sort of seen quite?
It's very commendable.
It should be. Yeah.
It's very commendable that people have done that. Social media can be used powerfully for so many good messages, so many good ways. And this is one example. Other groups that I've seen, even on Snapchat, are basically saying some of these, what we call social influencers, if you know someone that is in requirement of something like nappies, baby food, something in easy accessibility, but at this moment people are struggling, and other people coming forward, I've got 2 tins if you want, this shop is selling this, and doing that. So it's amazing about the good side. There's plenty of bad stories as well.
So to everybody, all our viewers out there, the message is keep up the good work.
Definitely,
in these difficult times,
definitely. And if it's something that you've thought about doing and you've thought you can't go abroad to do charity work, they say charity starts at home. So why don't you think about what you can do in your local community? But just be aware, be careful about the risk of spread. So you've got to do it in a controlled way as well.
Of course, yeah. Any more questions, Bash?
Yeah, just one of my friends was asking, you've probably answered the question, but this is a bit more specific. So if you've been in contact with somebody who thought they had symptoms, but they didn't actually get confirmed, so they're like, I'm not feeling too well, I'm just going to, I'm supposed to stay at home for a bit. Or you've been in contact with them. But then they turn around maybe a day later and it's actually, I'm completely fine. Probably a false alarm. Should you still self-isolate?
So when you say you're meaning the general public rather than...
because obviously you specifically.
It's a scary thing how it's going on with us.
What should you do if you come into contact with somebody, a colleague or somebody that you meet on the street, and he says, look, I've not been feeling so well, I've just been a little bit off, a little bit of a temperature and a sore throat starting, nothing major. Is that a sign then, given the way things are, to go home and say, I'm going to self-isolate? I've been in touch with somebody, I've been in contact with somebody, and I don't like the look of that? Or is that a case of keep it realistic, look at the situation, perhaps just carry on as normal? So
it's a question. It's a level of
it's a good question. It's a very good question, Bash. Yeah. What should we do, Doctor?
Okay. I think you can, when you were giving, should we do this, should we do that, you've kind of answered.
All right.
Anybody that is suspected, the cardinal symptoms that we mentioned, the cough, even if you're feeling unwell, let's just say if you're feeling unwell, if you are in contact with someone, that is the simplest way to self-isolate. Why? There's two reasons. You might say, as you said, one day later I feel fine. Yes. And we've got this approach, particularly the youngsters, those training that I'm fit and well, I'm strong, come and get me, it's not going to affect me. No, you're probably bloody all right. It's not you that it's going to affect. Yeah. Who are you going home to? Do you have parents? Do you have children? Do you have elderly that live with you? You are a carrier without knowing it, because you might simply just get a slight sniffle, a slight sore throat for a day and get over it. But how many people during that time of thinking you're well and where you've been and come into contact have you passed it on to? And that's the whole thing about the spread thing. So
stay on the side of caution.
Stay on the side of caution.
For everybody listening, stay on the side of caution. If you're unsure, stay on the side of caution. Okay.
We might get to the stage of a lockdown. There was lots of scares that London is. No, it's not that simple. Other countries are. Look at Italy.
Yeah,
I've got friends in Italy that I speak to about the lockdown. The lockdown's got even more severe now, where before they used to allow, okay, you can go out for exercising, you can go out to take your dog for a walk, you can go to the park. It's got to the stage where, because of the severity, because Italy has now overtaken China with the number of deaths, from what we call it COVID-19.
Just on that, why is, or do you have any insight into it from a medical professional as to why Italy seems to be more affected, or got it worse, to put it in street terms, than say China or the UK? Is it something? Something in
Don't they have a disproportionately large elderly population?
That's one of the reasons. They do have a larger elderly population, but I think it's also the way that the approach happened. China, call it a state where dictatorship, where there's so much control. One advantage of this control has been they have managed to control and contain it to some extent early on, and hence why there's hardly any new cases, and there's no new cases in their own people,
which is quite remarkable.
It's only people coming in.
Given what you've said about the virus, and it's quite remarkable, and a huge effort from China.
And some of the successful countries, Germany is another one that's doing very well. So there's lots of research going on at the moment as to why is one country, even European countries, doing better. If you look at on a graph about where we're going in the numbers, they say that we're a few weeks behind Italy. Okay? The measures put in place that are more severe are to try and avoid getting to the level that Italy has, but the way that our cases are rising, again, it's an impact of what's happened a few weeks ago. Travel was still happening. People were still coming from different countries. We talk about closing our borders, and yet the crucial time when it would be quite useful to control the borders, in my sense, didn't happen to the extent that could have done to contain this. There
was a few delayed responses. I mean, even PIA did their announcement today, didn't they, that they've stopped flights?
I believe many airlines have now followed suit.
PIA did something interesting. Have you seen the PIA have done a new advert about who they're going to allow in the country? So the only people that really are allowed in is if you have had the COVID-19 test within 24 hours. Okay? Easiest way, they might as well say nobody's allowed in, which at this moment in time I wouldn't blame them. Every country should have the same policy. I was about to travel today. I was meant to be abroad, okay? Before starting a new job, I was going to go on a 2 to 3 week holiday to have one final de-stress before starting a new job.
Where were you going, just out of interest? Just
somewhere like Brazil was going to be like
just Brazil, that
sunshine.
Yeah, no, I'm joking.
It was a chance to de-stress. I nearly made the decision of still going before I knew the airline lockdown was going to happen. My logic inside, call me selfish, was, okay, if I'm going to be on a lockdown, might as well be in a sunny country.
And there it is, everybody. There's a secret. Get yourself to a hot sunny beach if you're going into isolation.
Exactly. I'm being honest, the thought ran through my mind. Yeah. Why didn't I go? I decided this is definitely not the time to be selfish. What would I do if something happens to a member of my family if I'm not around?
Yeah.
Worried on a phone, I would be loving it.
Yeah, of course.
Yeah, I might still be in isolation, but it's a different sort of isolation. The second thing is, I don't know the healthcare. We are very, very, very lucky, and I'll say it again, how lucky we are to have the NHS.
I have said the same thing, just...
anybody that's used it, we've all had some use for the NHS. Some have used it more than others. You know a lot about the NHS and how much it's come into use for you and your family. Yes. And it's already overwhelmed, but it is a remarkable service. I wouldn't be working in the NHS if I didn't agree with it. What are we doing to look after it? We're not. So my idea was, if I went away, I'd rather have the NHS and our own healthcare than rely on someone else's healthcare. And secondly, at the moment, I've worked flat out on the front line to help out.
You do look a little bit exhausted, if I can say.
No, I'm not denying the fact. Yes, I've worked normally.
Are you personally, and many of your colleagues in the NHS, are you sort of feeling the strain a little bit? Are you sort of... And I know it's a tight-knit group, and I'm aware that you have a very strong bond. It's obviously affecting all of you. A little bit of insight into that.
I think there's so many ways. One, the day job.
Are you managing? To cope? Or are doctors and nurses?
One of the things in this job, wrongly or rightly, is you put others before yourself, and that's what's happening. Like I said, I'm used to just working 6 hours a day. I'll say I haven't even counted up how many hours I've done in the last week. One is because we're losing colleagues to the illness, being unwell, childcare issues, doctors having to isolate because of contact. Doctors are trying to, but we're not giving up. What we're doing, some of these doctors are working from home on laptops where you can still ring the patient. We're doing some video consultations with patients. So we are trying to run the service as much as we can, but it's overwhelmed. Doctors themselves are living in fear. If you think about this, I'm worried for so many reasons, and the government is to blame for this. If I am at the front line and I am coming into contact with patients, who's looking after me? What equipment have I got? Flimsy mask, the pinny aprons that we are getting, and gloves are not doing nothing. Those in the hospital are getting some better protection, which is these official masks called these N95. So the only useful thing about these sort of masks is for me to prevent some transmission, so I'm not coughing on you guys, right? This will. So
there is some good in them then.
That's the only thing.
See out and about.
That's all. There's not going to do anything else, but I would still be better because of even poor manners. Rather you cough into this than cough on each other. Okay. The true masks are in short supply. I'm trying to buy some in off the internet, but again, prices have shot up, and the government should provide it. So if we are stuck in the first line, we need the masks. We need the official, what we call N95 masks, which give you the filtration to stop the virus. And you might laugh at people that have got these what you call hazmat suits, but guess what? They're the people that have got better protection. If I need to see someone now, I need to be in that gear, because if I get unwell today, I've got family at home. I've got my grandma's 100 years old, who I am very worried about. So how would I feel if I am the transmitter to my grandma? I'd love to isolate myself and just watch Netflix all day. Have I got the time? No, I'm having to be out. Working flat out.
A tremendous effort from the NHS, from doctors such as yourself, your colleagues, no doubt that you'll know, from all the public. The level of appreciation and support shown has been amazing, really, and long may it continue. And obviously, having spoken to you here today, it's brought that even more into effect, and the actual impact it's had on the NHS and on you as a person as well. So keep supporting, guys. The NHS is there for us. Never give up is the message.
Yeah, I think one more thing is, once you do take into the account the content that the doctor's been sharing with us, it is important that you don't overwhelm the services.
Absolutely, Bash. Yeah.
When it can be quite apparent sometimes that people can be a bit overly cautious sometimes.
Just advice on that then, because the service is overwhelmed to the max.
Right.
The whole reason for this whole delay, Boris's approach is we can't prevent it, but let's delay the impact that it's having. It's a lot easier to draw on a chart, but basically, if you have a graph that shows how many people are affected, and if we left it alone, the curve would just go up and up and up as the number of cases affected over time.
Okay.
If we can keep ourselves in our house, what we're doing to that curve is instead of it going up and up, it's going flatter. Okay, there's videos out there, or I might even be able to share a link or draw something again that goes on your YouTube that shows that. But we have a certain number of beds in what we call ICU, or intensive care units, which are needed for the people that are most affected.
Is that all hospitals? All hospitals have a little sort of section set aside now for somebody possibly to isolate?
What's happening is the hospitals are now changing. People are getting discharged from hospital for other conditions to try and free up the hospital beds for this. So how unfair it is, but what can you do when we've got limited resources, limited number of respirators, which is what's needed, and ICU beds, which are the beds for the most unwell. Okay, fantastic. So if we haven't got enough beds, we have to limit how many new cases of severe people with COVID-19 come out. How can we do that? We can all keep ourselves indoors so that the hospital can deal with 50 or 100 new cases every day rather than 10,000 new cases, which might happen if we just allow it to peak. And lots of health professionals have given this advice about staying indoors and how much of an impact that can have.
It's very important. Almost vitally important.
But with regards to who to contact, the simplest ways, you can contact your GP, but it's by telephone. Do not go into the surgery. 111 is the service to use, but do not try and ring. The ring is for those people that have got more severe symptoms. You've got breathing difficulties, or you've isolated for 7 days and you are not getting any better, then ring 111. Otherwise, 111 have got an online service, and we will put the link on at this time. So it's NHS online 111, or with the coronavirus. There's a few different links. But literally use your online service. It has a questionnaire for you to fill out, and we've all got access on our mobile phones or the internet, the computer, to complete that, and it will tell you if you are at high risk, low risk, and what you should do, and about the isolation and all the advice. So the advice is out there. It's do we choose to read it and how to access it.
Wow. Absolutely fascinating, very thoughtful and in-depth insight there into this whole coronavirus thing, and all that's been helpful for everybody. Any more questions from you? I think from a coronavirus point of view,
it's been pretty informative.
That's been very informative. Do take the advice on board. Dr Shabaz has been in the medical profession for many years. Obviously, look out for yourselves and your family. It seems to be the sort of message that I'm getting.
And each other, remember.
And each other.
Stop this hoarding. The supplies are there in this country, especially for everyone to get through. If we all just stop being selfish and think about each other.
So just because we are running a bit short on time, but just as a yes/no, Ibrupofen.
At the moment, the advice is to avoid because of some of the research. Again, it's mixed research, but safer to avoid, and stick to paracetamol to bring the temperature down.
Okay, good stuff. Just a couple of quick questions about you. I mean, thank you very much for that. We really appreciate you having you on. I appreciate BurgerBash for having me on today as well. And I'm sure lots of our viewers would appreciate, this sort of the sort of simple and honest advice that we've got from somebody in the medical profession. Just moving on very quickly, I mean, just a little bit about yourself, Doctor. Obviously, it's Dr Shabaz. Is that something you've always wanted to do since you were little? Is to become a GP? Can you share some insight on that?
Do you know what?
It's a hell of an achievement, by the way. I have to say, I mean, is that something? Are we seeing your dream is in person here?
It's strange because if I look back at going back to school, believe it or not, the only GCSE I didn't do as well in was science.
Right, okay. Wow.
Believe it or not, because I used to like biology because I found it interesting, but I hated some of the other subjects. And this is to those out there, same thing, you know, school, we all find it a chore. At the moment, some children will be buzzing. We don't have to go to school.
Yeah.
But others will be, what's going to happen about my exams? So I never had that sort of an interest.
Right.
I went to college. My initial choice was to do maths, German and computing for A-levels. I wanted to be an interpreter for languages or IT. I wanted to make computer games.
Okay.
In the good old days when I had a Commodore 16 with the cassette.
I remember those with the cassette and waiting 3 hours for it to load.
That was it. What do you do? You put the game to load, go to the bathroom, get prepared for your prayers, have a shower, come back, you come back and you turn the cassette over to load the other side.
That's right,
and then
it's still on.
And then you play, and when you do a couple of levels, you have to play the cassette again. So them are the days that I remember. And I was like, I got into programming then, and I really wanted to make computer games. But when I came home with my GCSE results, my dad, he had a couple of his successful friends that were sitting with him, and they said, "What are you doing?" I said, "I'm just going to go and enrol at college." "What for?" These subjects. I said, "Why?" So when I told him I want to do languages, and he said, okay, he gave me the barriers straight away. Sometimes you have to be careful about barriers because we have this norm about Asians in certain careers. Okay, there's good and bad things about that. If your child has aspirations in some particular career, have a look at it, go with them, research with them. Not everybody is made to go into science, not everybody is made to go into certain careers. We all want to have these prestige careers. I've never looked at it as a prestige. I've done it for a reason.
Yeah, just to clarify there for everybody, I could have been a doctor, but I chose to work in council tax. All right, if anybody, just let's get that clear. Sorry, Doctor, you
okay. So when they looked at it, they said, okay, so you're going into languages. You're going to have to move to one of these European countries. I'll admit there was a lot of racism. Me going to Germany, France to be an interpreter might not have worked as a Muslim, as a brown person. So I had to take that into consideration. And we were talking years ago, this was said. Then IT said, okay, computing. Everybody does computing. How many people make it? How many people actually have something? I know so many people that have computing degrees that don't have a job or have just a standard job because there isn't them jobs, and the few that make it into, Microsoft, EA Sports, to make it into the big, there's very few. So he said, right, you need to do science. We know you've got the capability, so you need to do it. I still struggled in A-levels to focus. I didn't have any guidance.
I've known you for many years, Doctor.
We don't have anyone that's gone through university that's done it properly. So we didn't have the guidance and the support. Even my elder brother didn't take academia seriously.
Not everybody does. Yeah.
So I didn't have that guidance and support or mentorship. And it's important. Nowadays, we do have people that can give us that. There's careers advice. There's so much. Do we utilise it? Probably not.
Probably not.
So then I changed and went into A-levels, did the science, got through, and got a job at Boots as a pharmacy assistant, and actually didn't choose medicine because I thought it was too overwhelming, it was too difficult, and chose to be a pharmacist. And it was. So I chose to do a pharmacy degree at that time. Nearly quit after the first year because, again, I just got bored. I didn't find it interesting. But I'm one of them people, if I start something, I will stick to it. So I did my 4 years of university, became a pharmacist, worked, did the job. It's been 15 years or so since I was a pharmacist. And then during that time, there was many things that I came across, and I felt limitations in myself in what I could do as a pharmacist on helping people. People were coming and I was like, right, I know you need this. I was doing some reading, but I can't help you. You need to go to the doctor. So I thought, why can't I be that person? Rather than send them to the doctor, why can't I be that person? So that's when I thought, made a massive decision.
That's some serious sort of self-determination.
It was all self-realisation to think, okay, am I doing enough for what I can for those around me? And I was going to go into other careers for a money aspect. medicine is not a career for money. Whoever thinks, oh, it's a money maker, do you know what? There is so many easier jobs.
That's quite interesting, that actually, Doctor.
Go on,
I know we just.
I open the can of worms.
No, it's not a can of worms, but I would assume that the general public has an image of a GP or a doctor, and it is one that is solely about money ultimately, and everything that brings with it. But you just sort of said that maybe it's not everything that you perhaps thought.
Yeah, there's a lot of hours that go into it, don't you? So.
Yeah. Is it worth it for you, the hours and the reward?
The reward is worth it for what you want to do with it.
Right.
The reward is worth it for that, and for those around, for what you can do, and for your conscience to know that you can make a difference. People have different ways, and that doesn't mean doctors are the only ones that help people or make a difference. Okay, as we realise who key workers are in this whole pandemic, we need all sorts of people, cleaners, whatever. Everybody makes a difference. Okay,
so it's people.
Right? Yeah. No, it shows how we need to come together in so many ways. So it's not about that. If I was to think back, if I was into making money, business, so many other ways that would be money makers, I did not go into this for money, because for what you have to do, for each hour that you have to put in, and the hours that are unspent, the hours that are not rewarded. 10 years it's taken, hasn't it, to get from the day I went to university to the day I became a GP. 10 years of hard graft, of sacrifices in so many ways that you can't think of.
10 years.
And the debt that I still haven't cleared. So you talk about money, my student loan still hasn't cleared, because if you go to university a second time, like I did, you have to pay for it. So I had to fund it myself. So I used to work as a pharmacist. I was fortunate enough that I had a job as a pharmacist. So I used to work in the places that were open till midnight while taking my books with me and studying, so trying to earn to be able to pay my fees.
Some serious dedication there, Doctor. My hat's off to you.
Yeah, but people don't see that. So people see a different image sometimes and think, oh, living the life, cushy job, 9 to 5.
Convertible.
Yeah, the convertible, which is outside, by the way. No, I mean, just give us a typical day in a surgery. And I know you very soon, I believe, you're going to be having your own surgery somewhere. Give us a typical day in a surgery from a patient's point of view. One of the images that I try not to sort of do, but a lot of the public have, is when you're sat in a waiting room and you see a name come up and that person goes in, they come out after 5 minutes. And then sometimes you can be sat there with an ill child or yourself, and you can be sat there for 25 minutes. I mean, give us a little bit of an insight. Is it all just sort of see 3-4 patients a day and then finish up and go home? Or is it more behind the scenes? What is, just very quick, is it...
Typically, on a day-to-day basis, if you are doing a full day in GP surgery, you would see a minimum of 12 to 15 patients in the morning and 12 to 15 in the afternoon.
Right. I didn't know there was that many.
That's what when you said 3 to 4 and go home, I was thinking...
It's just a perception that I'm imagining I had for a few years, and perhaps a lot of the public out there.
Okay.
So there's that many.
The difficulty, if we could see more and we had the finances, the capability, the resources to do it, we would. That's not all you do. Okay, so if you're looking at, let's say even 15 patients, the average, okay? When you say somebody comes out in 5 minutes, that's a rarity. The way the GP model works is you get 10-minute appointments.
I believe so.
Okay? How many people, when you go to the doctors, you go in with one problem, I've just come in for this. We get it might take me 9 minutes, 10 minutes to deal with one problem. It comes to the end of the time and say, by the way,
one more thing, Doc.
I've just found, I'm like, my clothes are loose, I've lost 2 stone. Okay. To some people, losing 2 stone might not be nothing. To me, that's what you call a red flag, which is a worrying symptom. Okay. I can't now say, sorry, your 10 minutes are over, book another appointment. You've just opened a new can of worms and told me a symptom that I can't ignore. When you came in, you might have come in about a fungal nail, a discolored toenail, which wasn't a priority. if I would have known and you would have told me at the start. So we have got ways on how we communicate when you come in. I'll ask you, what have you come in for? And then you will say, right, I've got 4 problems. I will listen to your 4 problems, and then we'll have to prioritise what I could deal with on that day, because it might sound new to you, well, it's not fair, I've to understand, but what about, as you say, the people that are going through the door next? Right. Okay, sometimes you get an idea, sometimes my screen will tell me they're coming in about a cough. When they come in, they don't. They come in with something totally different. Right, yeah. So it's not that simple. There is not, I have gone home on days where I've realised I've not had a wee. It's not good advice. As a medical professional, we shouldn't be doing that either. I've not had my first wee since the morning till 6 o'clock in the evening. Wow. Because I haven't had the time.
On your feet.
I've gone home with my lunch.
So you can literally be that busy.
I've gone home with my lunch.
Well, obviously we won't see that.
No, you won't see that. And him is like, they're not doing anything, sitting in his room. Yeah. Do you know what? There's physical tiredness and there's mental tiredness. The risks that we are putting ourselves in nowadays with, you come in, if I don't get it right, okay, you come in with some symptoms, if I don't get it right, my whole career can be on the line from making one mistake. How many jobs are there that the impact is life and death on your decision on what you do? There isn't many. There isn't many. Yeah. So think about the risk I'm putting to, and that fear inside has a lot to play with. It is mentally draining. In between this, you are getting telephone calls. This has happened. This prescription is doing. A nurse has rang. A paramedic's rang. At the moment, is overwhelmed because the paramedic needs advice. One of your nurses needs advice. Somebody's getting bloods and they've collapsed in the waiting area or in one of the rooms. Who has to deal with it?
Right. So yeah, that's a whole different thing that I probably never would have.
You don't see these things. If we had the perfect model, we would have longer appointments.
Right.
You would come in, I would deal with everything for you. Okay. But we don't have the services, we don't have the time in a day-to-day basis. Do I go home on time? No. I've got into trouble with my daughter on so many occasions. I've told her, and I will pick her up from school. Okay, so you've allocated 3:15. I will be free. What happens? I'll even choose to finish work at 2 o'clock or 2:30 on that day, so that I've got enough time to pack up and go. Can anybody pick her up? Because I am stuck in work with an emergency. What can I do? Wow. I cannot leave my patient or my surgery in a dilemma or somebody without care and go off. So how many times have I had to put other things forward on top of my family? It's had a massive impact. Right. But if you go in this profession, that's one of the things that you do. You prioritise others, you think of others, and you can't be selfish.
I was going to say, I hope for the benefit of the viewers and listeners that people do start to appreciate what your GP does a bit more.
You've just heard it from literally the horse's mouth there. It certainly opened my eyes a little bit, I have to be honest. And I'm sure many of the viewers here will be quite surprised at that, really. So maybe it's not all a bed of roses, Bash.
Yeah, well,
one would think.
You can take my job any day if you want to swap roles.
I think I'll stick to council tax. I don't know about you, Bash. How's our team these days, you know? So, just very quickly, your plans for yourself for the future? I believe things are looking up and up and up. And what's gives a little bit.
Yeah, there's lots of things. I've always kept my finger in so many pies.
Good.
I work with the police as well. I've done.
Is that as
a specials constabulary? I've done that. Wow. In the limited time that I had, everybody gets shot. The police force gets shot. They're like, we're not used to having people like you coming on board. Yeah. But I did that for many reasons, because it's useful as a role model so that we can try and change cultures, we can try and change norms, we can try and help our community and think, do you know what, please, can we get on the right path? Can we you can be successful and make halal money, you can do it the right way.
Absolutely.
And what can you give back to your community? So I'm hoping with that is just to try and the youngsters out there, to tell them, look, there is other options. What can we do for it? So that's one of the things. I need to go back, but obviously it's difficult because I'm needed on the front line from the medical side. Yeah. I applied for the apprentice and got quite close.
Oh, right, okay, yeah.
I applied for the apprentice, I got through a lot.
Did you have a business idea, Doctor?
I've a few business ideas.
You had a few businesses.
Yes.
You had something that you were thinking, I could go and Yeah, do you want to share what that is a little bit, or are you keeping that a secret, or
would it be classified?
No, as in, well, one of the things that actually it's a running business is the fertility medicine. I've actually helped create a fertility medicine for those that are trying to get pregnant, and haven't even done any advertising. It's just been word of mouth, and I've kept a full audit as a professional. I've created a proper leaflet about it, official capsules for men and women, and it's had a 47% success rate. And
that is massive. By the way, that's really good.
One of the cases to share with is a lady that, for no names, but for 15 years she was trying to get pregnant, and she came in desperate measures, and I've worked in the fertility department at the women's unit in Burnley. So I've worked with knowing what's out there and what it works and who can afford IVF. And so I was like, okay, give it a try. And I'm not blaming, I'm not saying that it's all on that. It's, who gives and who takes. But you can do that, and it works as what you call as an antioxidant to try and rid your body of what we call free radicals, and it's had an effect. So one of the ideas was to take that to the next level.
That would be very interesting to see on The Apprentice, to see where you could
it'd be an amazing opportunity. And then I've got a gadget that I want to bring out. I needed to go to China to get this prototype built, so I've had to put that on hold, but I was going to I might even go to Dragon's Den one day to get the funding to take this up.
Yeah, I was just going to say, if you haven't got a patent, it's probably not a good idea to mention.
No, that's why I've just left it at a gadget. Inshallah, it's
so things looking good.
It's a massive idea, and community-wise, trying to get involved in whatever project. So whatever I can do.
I believe you do a little bit of charity work, as and when you can.
I do a little bit. I would love to do more, and one of my friends does a heck of a lot, so I would love to get involved. I'm going to get involved we were meant to go with Rise Support to Uganda recently when they went, me and another doctor, Dr Ansar, but because of the logistics and timing, it's just so difficult to get time outs, and for the foreseeable future, I think with this pandemic we're going to be stuck.
I think everything's going to be local now.
Fantastic. So. Absolutely. But a lovely story there. Things are really looking good. Long may it continue. Just last one from me. Obviously we're on BurgerBash. I have to get this question in. Best burger you've ever had, Doctor? Give us a lowdown. Give us a place.
I've had quite a lot of burgers as well. However unhealthy that sounds, but I do like trying out burgers.
Is it one that stands out? I have to say, actually, by the way, I have had food from Dr Shabaz's house, and the food there is a very high standard. So this is going to be a very interesting answer, by the way. Give us the answer.
That is true. You cannot beat home food, and you'll vouch that.
I can vouch it.
Yeah. To me, I think Archie's has still got one of the best burgers because of the.
What do you say about that?
It's a decent burger. It's consistent.
It's the combination. I still have a qualms about it, and the main problem is the bun. The problem with these burgers, and I hope someone, Bash, you'll have, if you've tasted a lot, is the buns disappear. You can't eat these burgers as a burger.
These designer gourmet
That's the
burgers,
problem. And to eat a burger with a knife and fork, to me, just doesn't sound right. It's all right for the big mouths out there that can get their teeth into it, okay? So Archie's has got one, but the buns, it's sort of like just goes soft and soggy, and then you can't, they're very messy. Mr. Joe's in Blackburn did me a decent burger.
I have been there. Bash, have you been to Mr. Joe's?
Mr. Joe's in Blackburn, So they've done a good burger. I used to like 50s. In 50s Grill in Keighley.
50s Grill,
but the only problem is, I don't think my stomach can take these patties, these pure beef ones. To me, they're too much. A simple chicken fillet or a peri. Round Nelson, if I'm in Nelson and you need a simple burger, I will admit the best burger still around, simple chicken burger, is Chunky's.
Chunky Chicken. There it is, guys. It's Chunky Chicken in Nelson.
Only because, like I said, they still consistently give you a decent size. I can't believe we're talking about this.
It's all right. It has to be asked on BurgerBash.
But they are still giving you a consistent size burger. UK Fried used to be the one for value for money.
Yes.
2 for 1. If you look at what they give, I'm looking at where's my chicken
It
inside.
has definitely shrunk. I don't know if it's
Believe it or not, I know a lot about, but I'm a foodie.
I believe
love my food,
Yeah.
and I will try places. I will do little reviews, nowhere near to your extent, but that's my takedown on. And speaking of burgers, has anybody seen the what's it called? The coloured burger. Have you seen the new unicorn
I've seen them on
burger?
pictures.
I saw it yesterday. I was asking, what is it? And it's basically, it comes as a bagel, and it's got the multicoloured unicorn colours, rainbow colours. Rainbow burger, it's called. Yes, there's a shop in takeaway in Blackburn that's doing it.
I think Lucky's in Oldham that's got that.
Right. Somebody else, yeah.
I mean, just to clarify for our viewers there, we're filming today live we're at Burnley General Hospital. And so there's been no burgers today, whereas traditionally with Bash you'd know that there would be a burger.
Let's just pause there.
Just let everybody know I want this recorded. Bash does always a burger.
Takeaways.
At some point.
You can
still do takeaways.
So
he's not getting away with it. But I just thought I'd get that in there. But certainly from me, this is we're getting to the end now. Just a massive thank you to Dr Shabaz. A huge thank you to my close friend Bash, BurgerBash. Some great stuff there about the coronavirus. Do take it serious. It is for real. It is here to stay. We're here. The team here is, if you need any advice or anything like that. Dr Shabaz is very busy, but if there's any particular urgent queries that anybody wants to pass on to me or Bash, I'd be happy to get in touch with him. But otherwise, music channels available and things. And just really a massive thank you to our special guest today, Dr Shabaz, and to Bash as well. So it's been a very good insight into the current times. So everybody out there, stay safe. From me, stay healthy. You, yourselves, all your families, everybody. Stay safe, stay healthy. Listen to the medical advice. Look out for one another. Look out for your community. Pass you over to Bash. Thank you very much.
Yeah, no, I just want to say thanks a lot to Turks for pretty much hosting it today, and thanks a lot, Dr. Sal, for all the information that you've given us. I hope it's more than sufficient, because we've covered a lot of topics, and what I'll do is I'll add timestamps to the video description, so you'll be able to get down to each individual question segment, and because there were a few people that did request a few questions and they've all been answered, so this is perfect. So hopefully this will be available to you on YouTube. I'll make it available on other mediums as well. Check the link and in the descriptions below for all the information that we mentioned.
Absolutely.
Check out the social media channels that I have as well. Hopefully see you in the next episode. Thanks a lot, guys.
Take care.